would think 2 years. Is that about right? Ballpark?
I think so.
I think 2 years is a good roundabout number.
And how were you referred to our office?
I was referred by an acquaintance in the business I operate in, and I had some issues, which I've been ongoing through most of my life with teeth. But happened to mention to him I had a problem, and he said, "Oh, you need to go see this person. Go see Farahmand."
That's great.
And that she will take care of you.
Wonderful. Now, how did we help you, Tom?
Well, my history is not good, number one. Some people inherit cars and houses and things. I inherited all English, Scottish, and Irish genes, which, if anybody in the world knows, is considered the worst teeth on the planet. My wife is Danish and has the greatest teeth, so I'm very jealous of her. Anyway, long story short, my entire life and family's life has been dental issues from the time I can even remember. Spent chairs. So, have issues there, number one. Have had, I remember being in high school and a dentist asking me if I smoked, which I did not, but that was the conditions of gums, just as, you know, he thought I was a smoker, which I was not. Never had a cigarette in my life or any smokable item, a senior in high school. So anyway, and over the course of my life, I probably haven't done myself the greatest favors, but also I, turns out, haven't had the best help. And especially in the 90s, probably, when I needed the most help, I would find out, let's say after 7 or 8 years of care, that it might not be the best. And that's when I kind of gave up a little bit. And I take the responsibility for that, but I had some experiences that said, you know what, I'm not going anymore. So that didn't help myself. But anyway, so when I got to Farahmand here, I'm in my 60s, and my parents both were really toothless in their 60s. We're all dentures and things. And I had resigned myself to the fact that, well, maybe it's time to just lose what I have and get a nice pair of dentures and get over it and move on. But Dr. Farahmand convinced me otherwise, that we could save what I have, and maybe when I can afford it in the future, a few implants, and you know, have some teeth until I depart the planet.
So Tom, what type of treatment did we do for you?
I would think my concern, or the main concern, was gum disease, and probably fairly serious. And so she did for me, which would be gum surgeries, bone loss. I had a lot of bone loss. And so we've been working as I could afford it here on, I would say, gum surgery, bone replacement, and everything she has done has turned out beautifully. So
and what was your experience with the treatment?
Treatment, everyone here is very pleasant, very nice, very professional, and that's kind of when I got scared away, as I realized I had some help that really wasn't, let's say, completely professional. And so I'm looking for the word disenchanted. Anyway, there's a...
So you were disenchanted before?
Yes, that's what I'm saying. I spent probably 3 or 4 years when I should have had serious help, not getting any, and kind of just got spooked off. Because when you spend a lot of money and trust somebody and things don't work out well, what do? You get nervous. And considering my genetic history and all that, I kind of resigned myself to the fact that I'm just, you know, I'm gonna lose these things, and that's how it is. So anyway, but I had a change of heart through care here, and so we're gonna save what I have, and over time here, I may even have teeth for the viewing.
Come on, Tom. Well, thank you very much.
Okay.
I appreciate it. Thank you.